The CDC has told state public health officials to prepare to distribute a vaccine as early as the end of next month. It has also sent out planning documents offering details on distribution and who should get inoculated first, putting the emphasis on healthcare professionals, essential workers, and long-term care residents and staff. Now, as you know, several vaccine candidates recently began phase 3 trials, and in the past week, Dr. Anthony Fauci and FDA head Stephen Hahn have said certain groups may get a vaccine before those trials are complete if the data is overwhelmingly positive. Now, our next guest has her doubts. Saskia Popescu is an epidemiologist at George Mason University. Professor Popescu, we appreciate you being with us. What do you make of this new guidance and the timeline that it implies?
It's extremely concerning. I think it's very premature. The concern is that we're going to be rolling out vaccines to healthcare workers very, very early on in phase 3, well before we have the data to support it.
So you say it's hard to see this as anything other than a pre-election vaccine push. So you're concerned this will
Very
be
much so.
politicized? What do you mean?
It's hard not to see that. If the vaccines are supposed to be pushed out November 1st and the election is really November 3rd, it's very concerning that suddenly we're pushing through very many safety protocols for vaccines for safety, which could have very serious ramifications in an effort for President Trump to push this through as an election piece, which is very concerning from a public health standpoint, from a safety standpoint, but also a trust in science standpoint.
So both Dr. Anthony Fauci and the FDA Commissioner Stephen Hahn, who are on the coronavirus task force, have said that a vaccine may be available for certain groups before clinical trials have been completed if the data overwhelmingly indicates it's safe and effective. What about that? What about if the data says this is overwhelmingly safe and effective? Would it be worth trying to get it to certain people earlier?
I think the biggest piece is that overwhelmingly effective and safe notion. And the truth is that many of these haven't even hit phase 3 until late July. So that means you have to enroll 30,000 people. You have to, in many cases, have 2 vaccines. So how are you really enrolling that many people and collecting enough data at that point to roll this out safely and to say it is okay for healthcare workers? Because the truth is, we don't want to be pushing this and we're just not there yet. A lot of this phase 3 takes years in the making. And even if we do have that overwhelmingly good data, which we simply don't have right now, that would be an entirely different ballgame. And frankly, we're just not seeing that from a temporal standpoint.
In your mind, what needs to happen before a vaccine is distributed, I guess, in any form, whether to frontline workers or widespread across the country?
I think we need to have, again, as Dr. Fauci mentioned, overwhelmingly positive data, not just that it's efficacious. We need to make sure that it's working at 50% of the time, that it's really protecting 50% of those vaccinated, but also that we're not having any negative safety outcomes or negative vaccine events. Because right now in the US, we do have, unfortunately, a lot of vaccine hesitancy. And the last thing we want to do is be pushing this for political reasons and further driving that vaccine hesitancy and distrust of the CDC or the science behind this.